ACL tears, about 75% of the time, are what we call non-contact injuries. So it's generally the athlete and the ground and nobody else. The most common mechanism is when an athlete is starting to decelerate, so they're starting to slow down. It's usually got a little bit of a twisting or pivoting element to it, and the stress applied to that ligament, which normally kind of holds the knee stable, overwhelms its ability to stand up to it. Casey is a very high-level soccer player who initially presented to us a couple years ago with an ACL tear. So we were able to get her fixed surgically and rehab to a fairly high level, and unfortunately suffered an ACL tear on the other side.
Prior to tearing my other ACL, I was playing to a very high level. So my goal is to honestly get back to that point, to feeling confident, to playing as much as I want to play and as hard as I want to play. So that's the end goal, is just kind of getting back to where I was before.
So we used a part of her hamstring to reconstruct the ACL. We did that on her other side. She did very well with that, so we expect her to have a similar outcome here. But the thing that's really critical, and the thing that we're learning a lot about now, is that if you don't address some of those anatomic and neuromuscular imbalance factors that were present when they tore initially, then really you're only bringing them back to that starting point where they are still at risk. So our real goal now is to understand the things that put them at risk in the first place, and then try to actually fix those things through a functional strength training program, which is actually based in some pretty good science about decreasing the risk of injury moving forward.
Prior to getting the surgery, when I got my MRI, got the results, and had an appointment with Dr. Bernardini, I actually spoke to him about coping, because I wasn't sure if I wanted to go through another surgery.
There's been a lot of work now that looks at the emotional and psychosocial components of recovery. So I think historically we've always focused on the physical, and now we realize that that's only a small part. So it's not uncommon at this point to have some apprehension, some psychological apprehension. That's actually all part of getting better. So those are things that we work on during the rehab process as well.
I think in the end, he was looking out for me for later in life. You know, if I have kids and I want to run around and do different things with them, play different games with them, it would be more beneficial for me to get the surgery. And so it was, I think, great advice from him, and it made me feel that he was looking out for me and my best interests and my future.
ACL reconstruction surgery, if done successfully, still has only about a 55% return to elite or competitive sport level. So, you know, our real goal for her right now is to have a very functional life from just an everyday life perspective. And then if we can get her back to a high level in sports, we'll sure do that if we can.